Hello, my name is Dr. Roderick L. Roll, and today I will be talking about different microbes that affect the nervous system. The nervous system, I'm going to separate it into the CNS, the central nervous system, and the peripheral nervous system. There are no known microbes that are supposed to live in the nervous system. So before we go into the microbes, we'll briefly touch on some of the parts of the nervous system. The meninges are the covering of the brain and spinal cord. So if you look in this picture, to the left, it is showing you what I call DAP. You have the dura mater, it's in tan. You have the arachnoid mater, that's purple. And we're going from most superficial to deep. Then we have the pia mater, which is white. All three make up what is called the meninges, and it covers the brain and the spinal cord. These are those three layers enlarged so you can see it a little bit better. So the most outer layer is the dura mater. The next layer is the arachnoid space. And then the final layer is the pia mater, which in this picture it is green. Those layers can become inflamed. So meningitis is the inflammation of the meninges or DAP. If you get meningitis, these are the symptoms: vomiting, headache, drowsiness, and so on. Now we're going to go into different microorganisms that might cause the inflammation of those three layers. Most of this information that I'm going to discuss came from chapter 22. So I'm going to cover the fungi that we know of that can inflame the meninges. Here is an example of a fungi that can cause issues to the meninges. Cryptococcus neoformans. This is an opportunistic fungi. Opportunistic, you typically can fight off that type of organism, but sometimes it sees an opportunity to cause an infection. Maybe your immune system is weakened. Maybe you're studying for final exams and you're depressed or stress is extremely high. Then this organism might be able to cause systemic mycosis. Systemic means it affects multiple organ systems. So in this picture, I'm looking at several organ systems that can be affected by this cryptococcus. It is prevalent in urban populations where pigeons congregate. So people who we see with this infection are in those big cities where a lot of pigeons might be. In this picture, I'm showing you a microscopic view of this fungus. This picture just shows some of the fungus growing under the microscope, growing in a petri dish. and what type of petri dish we can use to culture or cultivate this Cryptococcus. How do we get this organism? The portal of entry is the respiratory system. So you inhale this organism and you are inhaling spores or a dead yeast form that came from the bird droppings. So in the picture below, I'm showing you number one, you inhale it. Uh, it goes into the respiratory system. Number two is in the alveoli, and so on. Now that it's in the alveoli, number three, it goes to four and five. So it crosses the blood-brain barrier based on this picture. So now that it's inside of the brain, it is now able to affect the meninges. So infection of meningitis is the most common clinical symptom of cryptococcosis. It forms a tumor-like mass which causes meningitis, which then we'll see those clinical symptoms of headache, mental change, coma, and paralysis. Who gets cryptococcosis? The highest rate of infection occurs in patients with AIDS, and it is frequently fatal because they have a suppressed immune system. You also see this infection. Remember, it is opportunistic. It normally doesn't affect us unless it sees an opportunity. It also affects people who are on steroid treatment, diabetic patients, cancer patients also. So these individuals have an increased rate of getting this infection or allowing this infection to take hold because of their weakened immune system. If the patient has cryptococcosis, uh, they need to immediately start treatment of amphotericin B, which is an antibiotic which is known to target fungi. How does it target fungi? Previously, I discussed how it attaches itself to the ergosterol, which is uh, looks sort of like a cholesterol molecule, but it is embedded in the membrane of fungus. So in the picture below, I'm showing you the ergosterol, and that is how the drug will affect this microorganism. This slide here just summarizes Cryptococcus neoformans. This is an fungus that will affect DAP, therefore causing meningitis. The next material that I'm going to cover comes from chapter 19, which talks about different bacteria that affect the nervous system. So I'm going to talk now about specific bacteria, just a few. Streptococcus agalacea is the main bacteria that we will discuss for this slideshow. Streptococcus agalacea is going to cause neonatal meningitis. So this is meningitis that affects an embryo, a developing fetus, resulting in some issues where the DAP is going to inflame if they get this bacterial infection. This results from an infection transmitted by the mother in utero while the embryo is still developing inside of her womb. This baby gets an infection. How do they get the infection? They ingest the organism. So while in utero, the baby, let's say before it is birthed through the birth canal, it cries out and opens its mouth and consumes uh, some of the viscous solution that might have this microbe in it. If it's in the vagina of the mother, then now the baby will get this infection. So this disease, this infection, is most commonly caused by these three microorganisms, these three bacteria: Streptococcus algalacea, Escherichia coli, and Listeria. Previously, in another chapter, we talked about the Lancefield classification scheme and how we organize Streptococcus species into different groups. So this Streptococcus algalacea is going to be grouped into group B based on serotypes. Streptococcus algalacea normally colonize the lower gastrointestinal tract, genital tract, and urinary tract. So in females, normally you might find this bacteria in their vagina. Roughly 10 to 30% of vaginas tested contain this bacteria. Therefore, the crying baby might ingest this bacteria. So, pathogenicity. How do they get the disease? So, 60% of newborns are inoculated with Streptococcus algalacea through the birth canal or by a healthcare professional. If the mother was previously infected, the mother would develop antibodies against this bacteria. Therefore, she can passively give immunity to the developing fetus. If not, the offspring will not be protected from this bacteria. Then, if the baby gets the bacteria through birth, then the baby might receive neonatal meningitis, which the CDC suggests causes 12% mortality. Mortality rate can exceed 50%, but like I stated, 12% is commonly associated with this disease. Neonatal meningitis has two forms based on when the infant receives the infection. So early onset occurs if the infant is less than 1 week old, versus late onset occurs if the infant is between 1 week to 60 days when they receive it, maybe from a healthcare professional. If it's early onset, the mortality rate is 55%. If it's late onset, the mortality rate is 23%. Now, these are old values based on a clinical book I received. So these values may fluctuate depending on what book you're using. Mortality rate has been reduced very significantly to 5% through rapid diagnosis and supportive care. But 25% of infants afflicted will have permanent neurological damage, meaning mothers, suspecting mothers, sometimes get tests performed to see if they have the bacteria in their vagina. And if so, then measures can be taken to try to control the severity of these infections. So some of these permanent neurological damage that can occur is blindness, deafness, or severe mental retardation. So mental retardation is the retarding the restriction of nervous tissue from developing. Prophylactic is preventative care. So prophylactic administration of antibiotics such as streptomycin and penicillin at birth to children of infected mothers can reduce early onset morbidity by 70%. So again, you collect a vaginal swab and you know this mother has the infection. So you go ahead and do preventative care and give antibiotics to the baby. And this data was collected from a 5-year study from 1996 to 2001. Prevention. Immunization of women against Streptococcus group B to prevent infection of future children. So you immunize a suspecting mother. Therefore, she develops antibodies against Streptococcus agalacea. Then she gives the child passive immunity. This slide here summarizes uh, this bacteria that causes the meningitis of newborns. So what we've covered were 2 examples of organisms that affect the central nervous system, better yet, the covering of the central nervous system called DAP. This inflammation causes meningitis. Now we're going to move and look at the peripheral nervous system. Let's say the nerves that extend down the arm, the nerves that extend down the legs. We're going to look at those. Those are peripheral. They extend off of the spinal cord. To talk about this, we're going to look at some more bacteria that are in chapter 19. So now I've changed the name of the concept map to peripheral nervous system, and bacteria is what we're going to discuss. Everyone has heard of tetany or tetanus. So tetanus is a neuromuscular disease that is also known as lockjaw. This infection is an infection of the peripheral nerves. It is caused by a bacteria called Clostridium tetani. This bacteria is ubiquitous to the soil. It's everywhere. It's in dust, and it's in the GI tract of animals and humans. It is everywhere. This bacteria is an obligate anaerobic organism, and it produces endospores. Using a gram stain, it would stain positive. Looking at it under the microscope, it would appear as rod-shaped. And if you did an endospore stain, you would see those blue little circles, which are dormant stages of this bacteria called Clostridium. Spores enter the body through an accidental puncture wound. Recently, a friend of mine was bitten by a dog. When you're bitten by a dog, they're going to recommend and give you a tetanus shot because that is a puncture wound. The filthy mouth of the animal has this has this Clostridium bacteria. Burns, you can have the spores enter into the body. Umbilical stumps, frostbite, and crushed body parts. All of these are related to entry of the spores into the body. Tetanus results when the bacterial endospore germinates, grows inside of you because now it has the nutrient source it needs. While it is germinating, it is going to start producing a toxin. This toxin is called tetanospasmin. Tetanospasmin is a neurotoxin. How the neurotoxin works is the toxin blocks the release of the neurotransmitter from the inhibitory muscle, causing the muscle to contract uncontrollably. In the picture below, I'm showing you a normal synapsis. This is the junction between two nerves. The axonal end is going to release a neurotransmitter. Let's say this neurotransmitter is a stimulatory transmitter called acetylcholine. It is then going to bind to a receptor on the adjacent other end called a dendritic end. This is going to stimulate the nerve to the right to be activated or stimulated. So this is normal neural impulse. Acetylcholine is released from the excitable neuron, and if you look at the picture where you see acetylcholine, that is the excitable neuron. While if you look at the other side of the picture where it says GABA, GABA is released on the inhibitory neuron. So when your brain sends a signal to your arm to contract, if we follow this image, the signal goes to the triceps brachii, and that muscle contracts, therefore extending the arm. When that occurs, acetylcholine is released from those excitatory neurons to activate the tricep muscle to work, to contract. Simultaneously, the bicep has to relax. How does the bicep relax? GABA is the inhibitory neuron. It is released also. So that's why the biceps brachii does not contract when the signal comes. This is normal neuronal impulse for the upper arm. Well, what happens in an abnormal neural impulse? Well, if you look at the picture where GABA was being released, it is now being blocked. So it's being blocked by this toxin that was produced by Clostridium tetani. Therefore, if it is blocked, then now the signal that comes from the brain that activates the triceps brachii to contract, it is also going to contract the other neuron that goes to the bicep. So they contract simultaneously, and in normal situations, that doesn't happen. One is excitatory and one is inhibitory. The patient has the characteristic of muscles locking simultaneously. So what happens when you get this infection? So treatment by thoroughly cleaning the wound to remove the endospores. When my friend was bitten by a pit bull, they spent 20 minutes just cleaning the wound with saline. Why did they spend so much time? They had to remove the endospores. Then they gave her antibiotics. So administering of antimicrobials are then going to help kill this gram-positive bacteria. So the bacteria is going to be inhibited and destroyed, but the bacteria have already produced the toxin. So now you have to give some type of drug to block the toxin. So a patient with a clinical appearance should immediately receive the antitoxin therapy, um, which is called TIG, tetanus immune globulin. This only binds to circulating toxins that are in the bloodstream, not the ones that are already bound to the inhibitory uh, nerve. Therefore, the patient may require a ventilator and a tracheotomy to prevent aspiration, pneumonia, or lung collapse because the toxin has already bound. The drugs that they gave are killing the bloodstream bacteria, Clostridium. The drugs that they given you are binding to the free toxin that is floating in the bloodstream. You already have toxin that is bound. So that's why the person needs to be put on a ventilator. Prevention of this deadly disease can be controlled by getting vaccinations. So there's the tetanus vaccination, the diphtheria vaccination, and the pertussis vaccination, all combined into one shot. It's called DTaP. So DTaP is administered to children under 7. So I received one when I was a kid, and Tdap is administered to adults. So when I went to college and I enrolled in Florida A&M University, when I got to this school, I had to get my vaccination before I could enter into the school. So these will prevent this deadly disease that I mentioned. So this summarizes Clostridium. So when you get bitten by a dog and go to the hospital, instead of them looking into your history to see when was the last time you received a tetanus shot, they're most likely just going to give you one to save time because the Clostridium bacteria that's in you is already producing the toxin. So they don't have time to spend an hour or 2 hours or a day to look into your record to see if you've been vaccinated. So this summarizes all the different, some of the different microbes that we've covered that will affect the nervous system. And we started off to the far right talking about meningitis. Meningitis is the inflammation of the central nervous system's covering. Then we talked about neonatal meningitis. So we've talked about a few of these.